We may take our seats. Rakadula Danki. Ndimasi batho bothe. Re batanganetsa fano Seshego Hospital Depot in Tlikani. Ani amkela hinkwenu Thobela Rialocha. Kiliamkela kamuka here at Seshego Hospital Depot. My name is Lusani Namariri. I'll be your program director for today. Without further ado, I will ask the CEO of Seshego Hospital to come welcome us properly and accordingly, Ms. Imelda Masimula.
Thank you, Chairperson. Executive management of the department, led by the Office of the MEC, department officials, and Vodacom representative. Our Dumelang, Lekai, Arte. I'm just here, colleagues, to welcome you in this beautiful area. My task is just very simple, just to welcome you. And then those who feel we're outside, you just go out straight. Ronaldo toilet, we have toilets there. The other thing is just that thank you, Chairperson.
Thank you, Mme Masimula. I think as I call Mr. Kugan Subramani, who's our executive head in the Vodacom Limpopo region, as you ascend the stage, Mr. Subramani, he will be coming to tell us, part of the reason why we are here today and why Vodacom has brought us or has called for us here today. Thank you, Mr. Subramani.
Thank you, Program Director. Dr. Poppy Ramatuba, MEC for Health. Pardon me, I almost said MEC of Education. MEC of Health for Limpopo. The HOD in absentia. The Chief of Staff, Department of Health senior officials, team from Vodacom, members of the media, distinguished guests, ladies and gentlemen. Good day. In fact, the speech was written for the morning, so pardon me, I almost said good morning, but good day to you. We're running a bit late. The MEC has been under severe pressure with several meetings. So thank you, MEC, for joining us. I understand that you're under undue pressure. So MEC, when I used to attend the budget speeches in legislature, the MEC is always referred to the chambers as this august house. I think it's also apt that today I can say this venue that I've been through for the last 2 days or whatever. And I also want to say, welcome to this august house. MEC, this morning when I phoned some of my colleagues from Limpopo, they told me that they were not well, they couldn't come. But then when I told them the MEC is in attendance, doctor, and she's a doctor as well. So they said, okay, they will come, just in case that you got some time to have to sneak in a quick consultation time with you. So if your diary permits, maybe you can do a quick consultation with the colleagues who are sick from my team. So I just want to thank everybody for your time this morning. It is indeed our honor and privilege this day that together with the Department of Health, as we do the essential handover of the cold chain equipment to the Department of Health. The cold chain equipment is a key catalyst in actual storage of vaccines during this pandemic. And I just want to say that the Department of Health was doing an amazing job over the past 2 years, especially in Limpopo, as they actually strive to fight this pandemic. And we honestly believe that if we pull together all our resources, we will be actually the province that is leading to win this battle against the pandemic. I would also like to make a reference that over the past 2 years, when some of our people from China arrived, that was during the midst of the actual pandemic and the outbreak. Limpopo opened its doors to serve as a quarantine facilities, and Department of Health was instrumental at the forefront of this and actually emerged as great victors. And we want to say thank you for that. We actually salute you for that. You can give yourselves a round of applause. Take a bow for that. Just some few stats. In May 2021, the WHO set a global target for countries to fully vaccinate about 70% of the populations by mid-2020. Now, when we look at the stats from South Africa, the vaccination data, the actual data that we got is almost about 50% of the country's adult population is fully vaccinated. And we know that the key challenges in our country's vaccination drive is the cold chain management and the storage of vaccines. Vaccines are actually quite sensitive, and if there's any a break in the cold chain supply, it actually compromises the vaccines and becomes unsafe for actual utilization. So it is imperative that the cold chain storage, the equipment to transfer, to store, and deliver vaccines has priority, and the cold chain equipment which is being donated today includes freezers, refrigerators, cold boxes, and carriers, which have been distributed to about 30 sites across the 5 districts. So in all the districts of Limpopo, namely Capricorn, Mopani, Skukuni, Vembe, and Waterberg. Thanks to the actual outreach program, Limpopo now has about 56% of its adult population vaccinated. Our partnership with the Department of Health will help intensify the efforts to increase population immunity against COVID-19, and most importantly, save lives. The equipment distribution in Limpopo follows the donation of about 74 million, which was done by Vodacom Group and the Vodacom Foundation to procure this equipment. I think for the allocation for South Africa was about 35 million, which was to be spread across the country, and Limpopo being actually the benefactor of that actually has a huge chunk of it as well. So from a Vodacom perspective, is a purpose-led organization. We're no longer a telco, but actually a tech company. As you see, there's technology, everything actually revolves around technology. Even the freezers and the cold storage has monitoring device, has smart technology built into it. Our own custodian, the Department of Education, uses some of our technology, the IoT for two-way radios, our mobile technology, and then you get your vehicle tracking system and so on. So technology plays a key role in everything, and this is what we do as Vodacom. I think, as our company strategy, our purpose is to connect for a better future. The emphasis being placed on the actual digital society, inclusion for all, inclusion for all and planet. Education and health are actually very close to our hearts. That is why we make huge investments in these spheres. It's part of our social contract with government and to the people of the country. I think over the past 6 years that I've been at Vodacom, for Limpopo itself, we're in excess of 2 billion in the network and the infrastructure, and it's continuing to grow. We have more than 1,500 sites in Limpopo, focusing on deep rural access for our communities. And I can go on talking about how much we invest in the network and all the things that we do. But in short, we want to say, from a Vodacom perspective, we want to make sure that we live our purpose and we connect for a better future. With that, I want to say thank you for your time.
Thank you so much, Mr. Subramani. Up next, we'll be having Mr. Golden, who will be coming to explain the technical specifications of the equipment that the MEC is receiving today. Mr. Golden.
Thank you very much. Good morning. Is it afternoon already? Okay. Honorable Premier Stanley Matabata in absentia, Honorable Limpopo Health MEC Dr. Poppy Ramatuba, got that right? Representatives of the Limpopo Department of Health, representatives from Vodacom, members of the media, distinguished guests, ladies and gentlemen. I'm honored today to take the audience through Vodacom's group's cold chain donation program, which links so close to Vodacom's purpose and social contract in the society and communities we operate. As a supply chain executive within Vodacom, I was granted the honor to source, negotiate, and conclude the contracts for the cold chain requirements. It's been a long journey, and to be given the opportunity by the group to have run this program has been a huge privilege for me, and also made me realize that the strategic impact this program would have on our lives within South Africa, which has been with us for the past 2 years and is still ongoing. What I will cover briefly as part of our presentation today, and very briefly, is the program from a numbers point of view, which my colleague Coogan has touched on, and some technical aspects around the cold chain equipment purchased. 74 million was donated by the Vodacom Group and Vodafone Foundation combined, as Coogan has indicated. 2,197 cold chain units were allocated to South Africa worth 25 million, which were divided amongst the 12 provinces. Vodafone's foundation's donation assisted in the funding of 690 equipment units, which were allocated to Ghana. They received 400 to monitor the temperature of the cold chain units. This translates into a amount of 2.7 billion donation of equipment to the Limpopo province. Very importantly, the equipment was distributed amongst 30 sites across the 5 districts: Capricorn, Mopani, Sekekuni, Vembe, and Waterberg. Lastly, I just want to cover some of the technical aspects of the cold chain equipment. The freezers, which forms the first part of the cold chain storage. The freezers enable the Department of Health the ability to centrally and regionally store and manage vaccines at the set point required for COVID-19 vaccines of -15 to -20 degrees Celsius. The Department of Health historically had domestic type freezers which allowed for some resilience within their cold chain to manage pre-COVID-19 vaccines such as polio. However, Johnson & Johnson and Pfizer vaccines require higher resilience, and our donation therefore introduced the required cold chain technology for the Department of Health to achieve this. Our donatable mobility of vaccines into more remote areas, whilst maintaining the integrity of the vaccines. In conclusion, I'd just like to add that when Vodacom considered the cold chain storage donation, we realized that one of the benefits
Ascends to the stage.
Thank you very much, Program Director, to the executive of Vodacom, Mr. Coogan and Mr. Craig. I need to remember these names. You can't really forget Bomureki. It's very key and strategic. Thank you very, very much. And your entire team, delegations from Vodacom to the Department of Health, our executive management, when I look at them, I see the CEO of Sishigo who has welcomed us. I also see the Chief Director for our Government Information and Technology, Mr. Ravuruvuru, and the Director for Pharmaceutical Services, Mr. Tsedi, and the entire team from the pharmaceutical. You can see the men and women in gray who are responsible to make sure that those vaccines that you are talking about are stored safely, and they are also dispatched, and not only the vaccines, but all the other medication that we use as the clinicians in those peripheral areas. So I want to appreciate, it's not every day that you are invited to come and receive a gift. There's no one who can refuse to receive a gift, even though my program was very tight. I must apologize. I've arrived very early, you have seen me, but I still had an executive council meeting that we needed to conclude, which is one of the most critical meeting as chaired by the Premier and the entire cabinet. So for me, it's quite important what you have done. The donation that you have given to us, which it's around to the nearest, it's 2.7, because it's 2.666 million. So we're running short. I'm rounding it off because I wanted the remaining to be also, so that we can have a square 2.7 million. And when you round off 2.7 million, it gives you 3 million. So you can still add another 300,000 worth of equipment. Ms. Nemari here, our program director, will tell you, you are not wasting. You are not wasting, you are doing it for yourself. And the cold storage equipment that you've given us, I remember when we had to deal with the vaccines for the first time, and we were all workshopped about the cold storage, to say you need what, minus 70 comfort. It was minus 70 degrees to store your Pfizer. I think that was the first time. And it was a bit scary for us, because this you need industrial, the laboratory fridges that you can only get in a research institution. We don't need such. Who do you store at minus 70 degrees? So it was a bit scary until now when we are able to store. But it's quite important and critical, because one, the medicine, those degrees temperature that we were talking about, you might think they are just the numbers, but for us they are very, very important. Once you remove the medicine from that storage, that temperature, it means it has lost its efficacy. It's no longer effective. You must not use it. So it means if we do not have the proper storage equipment for our medication, we will not be able to vaccinate. It will just be a fruitless, wasteful, not even fruitless, wasteful expenditure. Because the millions that the state has used, the billions that they've used to buy these vaccines for us, will not be able to serve the purpose that they were meant for. And I know many people who are anti-vaxxers are still even today not believe that the vaccines do work. But if you talk to us who work in the hospital, those of us who are working with, not with the numbers in the office, that's the difference between some of us. We might be politicians, but we were not sitting in office and counting statistics as you were doing. You will read from WHO and you will wait for the minister to give you an update. No, we were seeing patients in the ward. We were talking about people. Those numbers that you talk about, we link them to individual. When they say 10 people have died, we know who that person is. When they say today 600 people died in the country, you remember the other time when it was tough, I think it was in 2020, December 2021, January, when the mortality rate was very high in this country, we were talking about people that we know now. It was no longer about a number. It was now about our brothers, our sisters. To us, it was our patients that we've seen. But believe me, after we introduced the vaccines, we started with healthcare workers. And I remember during the third wave, we started to see the numbers of mortality rate amongst the health workers going drastically down. And I still remember those who died during the third wave. I remember the doctors who died at that time. I made it my business to go and investigate if they were vaccinated or not. Because I needed to prove that there's no study that has been done. You can't forecast, you wouldn't say, I'm going to look at this literature and whatever. The information was minimal in terms of these vaccines. We were learning about this virus as time goes on. You said it nicely that as a province, we managed to be the one that housed those who were coming from Wuhan when it was still Corona. I'm sure none of you knew there would be a COVID. It was still a Corona. And all of us were scared of Corona. And when you hear the word Corona, it's equal to death. So at that time, it made us to open our eyes and start to study and read about this. Because for us, every challenge, we see it as an opportunity to put us to be ahead of our peers. But many people in the province didn't see it in that way. They saw us being cruel and brutal to them, to say, how can this MEC allow the premier and the president to use her to bring Corona to kill her own people? But to us, we were sitting there and say, you know what? This is going to help the people of Limpopo. And let me tell you, all of you, if I told those that I live with every day, if I'm not going to crash now with this Corona, I don't think there's anything that can crush me in life. Yeah. At that time, when people see this murderer, I don't want to share with you the SMS and the inbox that we used to get at that time. At night, we used to sit and cry bitterly to say, but why would people of Limpopo think me, who have gone to medical school to save lives? Hey, but I'm not just a politician. Now they will say you are just a populist when you go to a TV. And somebody had to do that job. But today is the people of Limpopo who are benefiting. Because that made us, Labour Comfort and everybody, to start to read about this Corona, understand what is SARS-CoV-2, what is COVID-19, what is the vaccine, how long will it take the vaccine? For you to win, what must you do? When we start implementing strategies, because we knew Limpopo doesn't have resources. We are poor. We are not Gauteng. We are not Western Cape. We're not. You must see, when we advertise a post of a cleaner, you receive 20,000 applicants because people have got no source of employment. When they see a government post of a cleaner, all of them want that. So being in that province, you've got to think above the box. You've got to be above your peers. You can't copy strategies of people who are rich and want to implement them. You've got to be rural. You've got to think rurally and bring solutions for our people. So that's why the people of Limpopo have been ahead in terms of fighting COVID. Even today, the people of Limpopo understand. I remember saying to my team, when people are talking about this, they are making our people to know that there is this virus. Because everybody wants to know, why are people angry that Poppy is bringing Corona? Then they will know, how do we protect ourselves? Because, wait, Corona mo Limpopo. Then you must protect yourself. Then they started protecting themselves because Corona was here. When I say, don't come, stay in Gauteng, they got angry, but they stayed in Gauteng. And they, protected themselves. So it was a challenge, but for us, we use it to benefit our people. And our people were the biggest winner at the end of the day. So I'm giving you this background to say you should be understanding that when you are investing with the cold chain, you are assisting to say we dealt with the fourth wave. When we dealt with the fourth wave, I can tell you, those that we admitted, which is the general population, are the people who were not vaccinated. Those who died, they refused to get the vaccine. It's a fact. They refused to get a vaccine. You know what is painful? It's somebody calling me. If I'm willing that person to the ICU to say, MEC, can you please come and intervene? Bring that vaccine here. And it's too late. I can't bring you a vaccine when you're already sick. And you know what is painful is that you will see all these anti-vaxxers going all out, especially some of the so-called prophets, whom I call false prophets. During the day, they are preaching anti-vaccine. At night, they are calling me, can I get a vaccine where I'm not known? Is it possible that I don't queue? And they get the jab, but they tell the congregants not to do the vaccine.